Hello and welcome to the GUV Hub, your source for reliable information about germ-killing ultraviolet light, or GUV. Hello, I'm Don Milton, a professor in the Department of Global, Environmental, and Occupational Health at the University of Maryland School of Public Health. Growing up in West Baltimore, I saw my mom getting sick with severe bouts of bronchitis over and over again. Later, I learned it was because she had whooping cough when she was little, long before there was a vaccine. She also grew up in a city where air pollution was so bad people couldn't hang laundry out, and the coal dust crunched under her feet walking to school. That's why I became a preventive medicine doctor dedicated to preventing illness from air pollution and airborne infections like influenza, COVID, and pertussis, the cause of whooping cough. And that's why I'm here at a university where we work to find better ways to protect our health and share what we learn as widely as possible. We're not selling products. When I was a medical student in the late 1970s, I saw an upper room GUV fixture for the first time. Johns Hopkins Hospital used them in the autopsy room to protect us healthcare workers and students against tuberculosis. Later, in my occupational medicine practice and research in the 1990s, I discovered that people working in buildings with better ventilation were healthier and had fewer colds and flu and less absence from work. But working with engineers and TB doctors, I also started to learn about the limitations of ventilation and the advantages of germ-killing lights. A great thing about GUV is that it's so effective that it can prevent super spreading better than any other building technology, including ventilation and filtration. Super spreading is what made COVID so hard to control, and it's why measles spreads so fast. Today, 10,000 people a year are still dying with COVID in the United States. Multiple bird flu viruses are threatening to cause another pandemic, and measles and TB are on the rise. GUV can stop super spreading from all of these airborne threats. That's why we need it now. GUV works constantly in the background, protecting us even before we know that a pandemic has started. And it protects us without making us change anything about the way we live and work, leaving us free to do what we need and want to do. Thank you for listening and visiting the GUV Hub.